When somebody falls for misinformation or propaganda or disinformation and it harms their health, and sometimes it kills them or a loved one, the tragedy is they trusted the wrong voice. They trusted the wrong person. So for clinicians and healthcare professionals or for people in public health, I think one thing that's really important is to listen to the other side. Listen to voices that we normally don't include or don't make time for or don't think are important because we don't agree with them. I turn on things that I don't normally listen to because our job is not only to communicate or to heal people who agree with us.
When I think about what physicians and other clinicians and organizations can do to help develop or regain trust, my mind goes instantly back to an article that's now amazingly over 100 years old by Francis Peabody. The secret of care for the patient is caring for the patient. And it's a lesson that seems so simple, and yet we have to relearn it repeatedly. And how do we care for the patient? We show empathy, we show humility, we listen, we lean in, we ask how and what questions, and we walk with them through their journey of health and healthcare, wherever that may take us.
Trust is the cornerstone of the doctor-patient relationship. I used to believe trust was just going to be present by me being a doctor, but that is no longer the case. I also used to believe that patients would just do what I told them to do because I was the doctor. That's definitely not the case. So what do we do to restore trust? Relationships require an investment of time. You need to be curious about your patient. Ask them about their lived experiences. Encourage them to ask questions and answer those questions honestly and transparently.
Individual healthcare practitioners have an opportunity to demonstrate empathy by actually making eye contact, getting down on the same level as an individual patient or family member, asking questions to which you are actually curious about the answers, not just asking questions to ask the question, but to do so because you're actually curious about what people think and feel. Being authentically yourself as you ask those kinds of questions, and then to actually demonstrate expertise. Part of why people are coming to us as healthcare professionals is to offer expertise, but to do so after we've established empathy and authenticity in a relationship is, I think, vital to building trust in today's world.